Hi, everybody. My name is Michelle Lewis with Siouxland District Health Department. And this month for our child chip update, I will be talking regarding our preventative care topics, and that is going to be on STIs. So we do have a coalition that meets every couple of months here at the health department that addresses this topic. And I'm just going to share some of the data that that group has been working with and some of the events that they've been working on. So as you can see, the goal for that group over the last couple of years has been to decrease the STI rates in the Siouxland area. And these charts kind of depict how the data has been going over the last few years. That top corner there is the gonorrhea rate. As you can see, the blue columns, the ones that are really tall, unfortunately do represent the number of cases or the rates of cases in Woodbury County. The orange is the Plymouth County, and then the gray is the state of Iowa. So unfortunately, we have a lot higher rate of gonorrhea in Woodbury County. On a positive note, you can see that that trend has slightly decreased over the last couple of years. Just some additional information for gonorrhea, Woodbury County did rank first in the state in 2019, 2021, and 2022. So again, because our numbers have gone down, we have improved the last couple of years. With regards to chlamydia, again, you can see that that blue line does represent Woodbury County. The gray line is the state of Iowa, and the orange line is Plymouth. So we obviously, again, are much higher than both the state rate and Plymouth County. But on the positive note, those numbers have gone down slightly the last couple of years. For chlamydia, Woodbury County ranked first in the state in 2022, and then ranked second in the state in 2019 and 2021. For gonorrhea, if I didn't already mention it, the most common ages of diagnosis are 15 to 39 years of age. With chlamydia, the common ages are 15 to 29 years of age. So for syphilis was really not on our radar a couple of years ago, but definitely now is. As you can see, that blue line is the rate of cases in Woodbury County has definitely spiked. With the spike of syphilis brings on the concern of congenital syphilis. That is when it is passed on to the babies that are then born with congenital syphilis. Why that is concerning is because a lot of the health impacts are very serious. And I'm just going to quickly review some of these. And that shows you the concern and why we are so concerned about it. Is that it can cause miscarriage, stillbirth, prematurity, low birth weight, and then potentially death after birth. Enlarged liver and spleen, jaundice, and meningitis. It can cause deformed bones, pain, swelling. It can cause blindness, deafness, seizures, paralyzed arms and legs. It can also cause a variety of rashes, and then just failure to reach developmental milestones and intellectual disabilities as that child ages. So that is why it is so concerning. Over the last couple of years, we have worked with our OBGYN providers and other medical providers that do treat prenatal patients to really encourage testing. So now all of our local clinics are testing twice during their prenatal visits, and then also our birthing hospital is testing at birth. Because if we test and there's a positive, we can get that treated. And hopefully those health outcomes are a lot better for that child. So that is just a quick update on some of the data and some of the changes in the testing that we have done here locally. The next slide shows some testing flyers. These are flyers that you can print off from our website. You can download them and then hang them up in your organization. One is kind of geared towards more that adult professional population. The other one is more that youth and adolescent. So we just encourage they can just take their phone, swipe the QR code, and then find specific addresses and hours of service for those locations. If you are not able to get specifically to like the public health department, Siouxland District Health Department, we do have staff that can do on-site field testing or go to the home to test for an STI. The left-hand column kind of shows places where people can get tested. Again, at Siouxland District Health Department and at Siouxland Community Health Center. They can also go to Planned Parenthood, the local urgent cares, or the hospital emergency room. We do not advise that. They have other more serious conditions that they do need to treat. But yes, that is a possible location that they can go. Between Siouxland Community Health Center and Siouxland District Health Department, the last year we have started to test at these locations as well. Seaboard Triumph, Western Iowa Tech Community College, Morningside University, the Warming Shelter, and also the Woodbury Juvenile Detention Center. So if you're interested in learning more about testing, feel free to reach out to Siouxland District Health Department, and or if you just want to print those flyers at your organizations, feel free to do that as well. The last thing I want to cover is just to kind of do a shout out for Darla Peterson with Iowa HSI. She provides training to providers that might see clients, whether it's just for medical appointments, behavioral health, mental health appointments. Anytime that you are having a conversation with somebody and maybe the sexual health history comes up or doesn't come up, and you just kind of feel a little awkward of having those conversations, Darla comes in and kind of trains staff on how to have those conversations. We are seeing that potentially people are coming in to the doctor's offices with potentially sore throats or UTIs. And when a UTI comes back negative or a strep throat test comes back negative, it just kind of stops. But again, if you had done a more of a complete sexual health history exam or discussion, you might start thinking about we maybe should need to be testing for STIs. So again, Darla will come in and kind of do that training for your staff. So if you're interested, you can always reach out to Darla with her email that's on the slide. Then I just want to remind everybody that we do host an STI coalition here at the health department. We meet on a quarterly basis. And so the next appointment or meeting is February 10th here at the health department from 10 to 11:30. So if you're interested, just let me know. Otherwise, you can stop in and join us. So that is all I have for this month. So thanks, everybody.